has been challenging. At the height of the surge, we were seeing very sick patients and we didn't really know what the consequences were going to be for some of those patients.
We've seen a lot of children come in with underlying conditions and different types of symptoms, all related to COVID. It's been tough.
Maternity was a service that really cannot stop. What we had to do really quickly was redesign our services so that we could concentrate staff in the places that we needed them.
At the Nightingale, I took up the role of a registered nurse working alongside specialist ITU nurses. As a team, it was really exciting being able to see everyone pull together.
I think the main thing over the 6 months that we've seen is the ability of colleagues from all over the organisation to pretty much drop everything and say, how can I help? What do you need me to do? And I think that's been really inspiring, actually. It's been a privilege to be part of. A couple of years ago, the Trust set up a wellbeing project to support staff, recognising that NHS staff have quite a challenging role. We started beginners run groups for staff of an evening. We have over 200 runners in the club now.
Running has been a big saviour to me. It's helped me a great deal because it's kept me grounded, kept me sane, relieved some of all the anxiety I was feeling at work. Getting out on the road and just running was relieving a lot of that tension for me, and it's continued to do that.
I think staying active for me and cycling to work has been very good for my mental health throughout the whole crisis. I was cycling to and from work, so I had this made for me so that everyone would realise I was a sort of serious cyclist on my way to work, and I was hoping for some claps to get me up some of the steeper hills, but that didn't unfortunately happen.
To be able to go out and run, to feel the sun, to be able to hear children laughing, to be able to see birds and nature was really grounding and was an opportunity to be able to streamline my thoughts, to be able to try and compartmentalise some of the things that we had seen or the experiences we'd dealt with.
Personally, for me, the Run Club's been hugely important. I think running and fitness has been absolutely essential in this period. I can absolutely see the difference in my resilience and my mental well-being when I keep active.
We've got a club here and we're coming together to run the virtual London Marathon and raise funds for our charitable funds here at Lewisham and Greenwich. A big hole has happened since the pandemic in terms of money going to charities to the tune of about 4 billion. I don't even understand that number as a concept, but any little that we can do, anything that we can do to help will go a long way.
I think the chance to really make sure that we look after the mental and physical well-being of our staff is essential. So that's where the charitable funds, I think, will make a really big improvement for all of us.
I'm really excited to be supporting the Lewisham and Greenwich Running Club with our virtual run. I'm going to be part of one of the run walk groups to cover the 26.2 miles between Lewisham Hospital and Queen Elizabeth Hospital sites.
Walking 26 miles in a mask is going to be a tough thing to do, but obviously we need to make sure that we're doing the right thing. We've raised nearly £3,000. Hopefully the money's going to go on redecorating the department. We used to have a beautiful department that had loads of lovely stickers on it and things hanging from the ceilings, but obviously with infection control, a lot of our stickers, a lot of our toys have gone, so we need to bring that back. We need to bring the magic back.
It's been really disappointing not being able to get out and run as we'd planned for London Marathon, but I think the opportunity to take part in the virtual marathon is really amazing, actually. And if we can raise some significant funds, we can really look at how we can invest in staff and their well-being to make sure that they're better able to cope if we have a second wave or if we have a really challenging winter, and that we can make sure that we're better prepared for that.